So welcome to our Focus Forum. Thank you for sharing your lunch hour with us. Our topic today is mental health in a time of COVID. I'm Rita Riker, President of the Board of Focus Greater Syracuse. I'm pleased to welcome you to our forum and delighted that our expert panelists can join us today, Lisa Alford, Marla Byrnes, and Ron Fish. They will be formally introduced in just a moment. Today's forum continues our series focused on how we in Central New York are coping with COVID-19. So just a few reminders about our format. This forum is scheduled for 1 hour and we will be recording today's session. Our panelists will each present for about 5 minutes, followed by about 20 minutes of Q&A, where we will address as many of your questions as possible, many of which were submitted ahead of time, and we appreciate that. If you have a question for our panelists, please use the Q&A button at the bottom of your screen. Board member Brian Hoke will be monitoring the Q&A. And if you're having trouble using Zoom online, please try dialing in using the alternate phone number and sign-in information included in your invitation. Brian has also placed that information in the chat box. Now, I'm very pleased to introduce our moderator, Paul Jocelyn, Executive Director of Access CNY. Paul has been Executive Director of Access CNY since August 2016, shortly after the agency was created through a merger of two agencies, Enable and Transitional Living Services. In 2018, Access CNY merged with Spalding Support Services, and in 2019, yet another merger with CASA Onondaga. Access CNY currently serves over 3,300 people a year who have either a mental health diagnosis, developmental disability, or physical disability. The agency's services empower individuals to create and achieve their own success in a community where all people belong. Paul?
Thank you, Rita. And thank you to all our participants for joining us today. We have three terrific panelists, as Rita mentioned, all of whom are experts in their field, but with very different backgrounds. I know there's always a chance that we run a little short on time with events like this, so I'd like to take the opportunity now to thank Focus Greater Syracuse for providing a platform for today's very important discussion. Focus has been an invaluable resource for citizen advocacy during the pandemic, and of course, well before these last 9 months as well. With that, I'd like to introduce our first panelist, Marla Byrnes. Marla is currently the president of NAMI Syracuse, which is the local division of the National Alliance on Mental Illness. She has worked as a psychiatric nurse at Hutchings Psychiatric Center for over 30 years and has been involved with NAMI Syracuse for over 25 years as a professional, a family member, and a person who has experienced depression. Marla facilitates a monthly family support group with Ann Canastra. She has offered presentations throughout the community on mental illness, fighting stigma, and ending the silence in middle and high school students. She believes that we must talk about mental illness and break through the shame, embarrassment, and stigma that keeps people from seeking help. Welcome, Marla.
Thank you, Paul. You did a nice introduction. I hope I live up to it. Well, folks, yeah, we're still in the midst of COVID. This has been a year unprecedented. For me, the National Alliance on Mental Illness, our Syracuse chapter is a major support for myself. It's family members getting together as caregivers to help kind of voice our own concerns, share resources, and just talk about how much of a challenge it can be, especially in these times, being a caregiver. So what we really focus on is how do we take care of ourselves? And I would encourage anyone who's a caregiver to seek out support groups, whether it's, for us, it's the National Alliance on Mental Illness. It's people who've been impacted by mental illness, which 1 in 4 families, the statistics show, are impacted by mental illness. But there's other support groups too in the community, the Alzheimer's group, bereavement. So don't forget to look for other supports that are out there. Today, I just want to stress, take care of the caregiver. Be kind to yourself. find the things that recharge you, that give you the energy that you need to be an advocate and a caregiver. For myself, a half hour ago, I was in a minor meltdown because my computer wasn't working right. And I'm thinking, oh my gosh, so, from moment to moment, we can just barely be, making it. And again, you got to have some humor in all this because it's a test. It's a test to our inner strength. And as caregivers, we tend to be quite stoic and, we're always there for other people. But we have to be there for ourselves too. And sometimes we need to lower our expectations for ourselves and for others. We need to definitely have a sense of humor, and we need to know when it's time to ask for help. And that's where support groups can be very helpful because they can kind of give you feedback, and they're people that are walking in the same shoes you are. So you can hear what they're saying. And sometimes you just need somebody to listen. Now, we are going to talk about the emotional support line that New York State has created for this time during COVID. And I'll tell you, I called the other day. I was just feeling really frustrated and irritated. And boy, I just wanted to vent. So I called the emotional support line, and it's in like 7 or 8 different languages. There's a specific line for essential workers, and then there's a line for the rest of us. And I found the gentleman was very helpful. He was a good listener. He heard me out. He was very encouraging, and I felt better. So sometimes you just need an ear, an unbiased ear to hear what your complaints and concerns are. Certainly reach out to your family and friends and your church or synagogue or temple. But again, my message today is take care of the caregiver. Be kind and generous to yourself. So Paul, back to you.
Thank you very much, Rita. Great job. And thank you for mentioning your Project Hope and the other resources that are available. And I noticed Brian put some information about that resource in the chat for anyone who might be interested. Our next panelist is Dr. Ron Fish, who is Clinical Director of Psychological Healthcare. Psychological Healthcare is a group of 75 clinicians located in the greater Syracuse area. Dr. Fish is a clinical psychologist with extensive experience in a wide variety of treatment modalities and populations. He specializes in programs integrating behavioral health and medical care. He is a master trainer for the trauma resiliency model with expertise in the treatment of patients with complex trauma. He has developed behavioral medicine programs employing a psychoeducational approach for fibromyalgia and diabetes. In addition, he has published papers on couples therapy and hypnosis and uses hypnosis for pain management. He has taught extensively on stress management, fibromyalgia, depression, and marital therapy. He is a psychologist member of the peer support team for the Syracuse Police Department. He is currently working with a variety of medical provider groups on burnout prevention and treatment. And lastly, he's the proud husband of Linda Stonefish and father of 4 wonderful adult sons. Welcome, Dr. Fish.
Hi, thank you, Paul, and thank you, Marla. That was terrific. So I think a picture is worth 1,000 words. So I'm going to share my screen because I'd like to give to you all a simple way to think about your situation, our situation, to think about, let's see if I can get to it. No. There we go. All right. So what I'd like to do is introduce this concept that myself and a number of other people have taught to thousands of Central New Yorkers. And it's a way to think about how we're doing. So when we talk about kind of coping in the time of COVID, what's important is to have a way to assess how we're coping. So I'm going to give you these general ideas now, and then we can get more into specifics as we address some of the great questions that were asked. So we start with this concept of the resilience zone. The kids call it the okay zone, but I think of the resilience zone for myself as when I feel most like myself, when I'm comfortable. It's a state of well-being in mind, body, and spirit. So if you just think about like when you felt okay, when you felt all right, when you just like life is okay. And because the fact is that during this time of political and economic stability, there's a lot of triggers. We're in an unprecedented time, and people are being, whether it's exhaustion or isolation or fears of unemployment or fears of illness, there's stressful or traumatic events that we say trigger us out of the zone. And if you look to the upper right of your screen, we see what it's like to be in the high zone, this kind of irritable, edgy, and this is the fight-flight reaction. Irritable, edgy, people who have pain issues experience their pain more intensely. And some of us go into the low zone when there's a stressful event where we get sad, depressed. We just want to close the curtains and insulate us from everything that's going on. And so I'm presenting this to you as a way to think about your own situation in terms of becoming acquainted or more acquainted with your own nervous system, and think about, okay, am I my resilient zone, in the high zone, low zone? How am I doing? Because sometimes our zones are really narrow and sometimes they're wider. So when you go through a day where things are really tough, Marla talked about, having the computer problem and wanting to throw it, right? And so we could say maybe her zone was a little narrowed then, and it didn't take much to bump her off. And then other times when we're not dealing with technology, or technology's going okay, or life maybe seems more comfortable, then our zone might be wider, and we may have more capacity to tolerate life's frustrations. But the fact is, in this time, we're going to get triggered, and it's especially important now because it seems like whatever end of the political spectrum we're on, we're all, I don't think we've ever faced such a time of uncertainty for most of us in terms of, what's going to happen tomorrow. We're going to be able to get out of our house, mask, no mask, vaccine, no, what's happening. There's a lot to trigger us, not to mention, a dozen other stressors that people could have. And so over and over and over again, what I'm inviting and encouraging you to do is to check in with yourself and to notice the distinction between sensations of distress and sensations of well-being, to kind of have this resilient zone image in your mind and notice when you're doing okay and when you're not. And then when you're not, do things to bring yourself back into the zone. So I think that I'll stop there for my 5 minutes and turn it back to you, Paul.
Thank you, Ron. Greatly appreciate that information. Our third and final panelist today is Lisa Alford, who is the Commissioner of the Department of Adult and Long-Term Care Services for Onondaga County. Lisa joined Onondaga County in 2007 as Commissioner of the Department of Aging and Youth. Under her direction, the department focused on collaborating with local agencies and service providers to ensure the citizens of Onondaga County easy access to programs and services designed to enhance their quality of life and strengthen our community. Most recently, she had been the Deputy Commissioner and Executive Director of the Office for Aging. Commissioner Alford previously served as Child and Youth Services Director for Peace, Inc., where she supervised the Head Start, Early Head Start, and the Big Brothers Big Sisters programs from 1996 to 2007. Active in her community, Lisa is currently a member of the Board of Directors of the Health Foundation for Western and Central New York and the Oasis Senior Education Program. She is on the American Heart Association Community Action Committee, the New York State Behavioral Health Services Advisory Council, and she is a member of the Junior League of Syracuse, the League of Women Voters, and Kappa Alpha sorority, an international community service organization. And Lisa also finds time, believe it or not, to serve on the New York Connects Long-Term Care Advisory Council. She holds a bachelor's degree from Hampton University and a master's degree from The Ohio State University. Welcome, Lisa.
Thank you so much, Paul. Welcome, everyone. I would just like to thank the community for being here today. And as you mentioned, this pandemic has certainly been an unprecedented time for our community and how we go about serving people in the community. And I will add to what has already been said from an administrative perspective, the real challenge with reduced resources and how that has impacted the types of services in the community, as well as the potential long-term impact of what that might mean, especially as it relates to behavioral health services. We know many people in our community have experienced great feelings and great isolation, either as a result of not being able to go out, anxiety, grief, and even when they do have support, grief and other milestones have had to be celebrated or taken place in very different ways. People are not able to have large, if someone does pass, for example, to have large funerals or hug others and things like that. We know there's certainly been an increase in depression and suicide in our community. There's certainly concern about increases in child abuse and domestic violence, as well as just the physical and mental exhaustion. And that would be for the community at large, as well as for the helpers, those who have been helping and continue to help. The exhaustion physically and emotionally of how they have worked to help others in our community. And I would be remiss if I did not talk about, we also know, and it has heightened the disproportionate impact that COVID-19 and services have had on particular communities, whether it was accessing care or even being comfortable with care and caregivers that are available to them. We know people who have been laid off or lost jobs, and then as a result, they've lost their health insurance. And so even if they did want to reach out for behavioral health supports, they may not have been able to afford it because they no longer have health insurance. Or we know that we already had, in some instances, the difficulty with persons finding mental health or behavioral health providers to serve them. And we know that many providers have certainly done quite a bit of adjusting and have looked for ways in which they could provide remote or telehealth opportunities. And for many people, that actually has been a plus. They may have not been able to get to a behavioral health provider before, but they can call someone up on a telephone or computer and actually access those services. So in some ways, it is actually given us the ability to serve people in different types of ways in our community than what we had been doing before. I do believe that some of these changes will probably become permanent in our menu of options in ways that we do provide services. So that in that way, that certainly has been a plus. I think Ron and Marla have certainly already mentioned some of the ideas of needing to give ourselves grace and how we have managed this process. And as I said, it's the community at large, but also those of us who are helpers in the community. The ability to sometimes have those meltdowns or sometimes figure out ways, how do I de-stress in what is certainly a non-traditional, unexpected, an environment that we don't necessarily know what's going to happen, whether it's changes of, am I having to isolate? Is someone else I know having to isolate? Is someone I know ill or sick? And so we've all had to learn, or we're certainly being given the opportunity to learn, how do we manage in these very uncommon times? So again, thankful for the opportunity to be here, and look forward to the panel.
Thank you very much, Lisa. I could not agree more with your comments about the importance of telehealth during the pandemic. It's been extremely important for XSCNY and the people we serve. I'm now going to turn things over to Brian Hoke, who has a list of questions that have been submitted by today's participants.
Thank you. I'll add my thanks to everybody who's joined us today, particularly and especially Paul and the panelists. Thanks so much for sharing your insights today. We have a series of questions that we collected in advance of this event. We may or may not have time for a few more. If you do have some, please feel free to put them in the Q&A on this event. So first up, we have a question someone sent in who asked, many people speak of an underlying depression or anxiety, largely due to the length of time that the pandemic has stretched on. How would you describe this feeling? And what might you tell someone that it is a mental health issue that needs to be dealt with, as opposed to just a reaction to the ongoing news? Ron, do you want to take that one?
Sure. I think that the determining factor is are we stuck in those sensations of depression or anxiety? So in my design is, are you stuck in the high zone? Are you stuck in the low zone? Do you not really feel like yourself? So I think about it in three spheres: a personal sphere, like how's my thinking? I'm having, thoughts, negative thoughts. Am I sleeping? Am I eating? Am I taking care of myself? Is my self-care really going downhill? And then also work and relationships. So self, and then am I able to function at work? Am I able to concentrate? Am I able to get the job done? Do I show up? And then my relationships. Is there a deterioration in my relationships? What's happening there? Are people saying, Ron, you're not acting like yourself? So it's really taking a good inventory of yourself and your situation, listening to others, and going from there.
Good, thank you. Anybody else want to chime in on that one? Okay, thanks, Ron. We have another question. This one directed, Lisa, to you. How can we help isolated seniors improve their mental health? Can you suggest specific programs or activities that are available during lockdowns and social distancing protocols?
Sure. Well, certainly our Onondaga County Office for Aging has many services and support groups that we actually have, that we've also moved to an online model. So I would certainly encourage people to call our Onondaga County Office for Aging, especially if they are caregivers, to and that's 435-2362, and they can get information about those online caregiver support groups. Also, 211 actually provides friendly phone calls to their telecare program that they have, and they will actually give a friendly phone call or daily medication reminders to persons who are isolated or homebound and or otherwise vulnerable, but need that kind of reminder or support. And organizations such as OASIS, they have registration for classes that people can participate in that are online. So we encourage people to reach out to organizations like that. And I would add that many of these senior centers in the community, while they may not be meeting face-to-face, they have found ways to convene virtually in various ways. So, reach out to the senior centers in your community and In addition, I know there certainly is a concern about people, especially with Alzheimer's disease or that need those additional kinds of support. The Alzheimer's Association is another good resource. They have online and virtual support groups for persons that are with dementia, and they've been very creative. Our Central New York chapter, they've actually been holding online social engagement programs. And I thought this was very creative. And this was specifically for persons with dementia, where they actually do virtual tours of things like museums, crafts, and baking. So I think many organizations have really looked for and found ways that they can virtually serve people in the community, but do it in a safe way.
Interesting. Lisa, did the 211 friendly phone calls, did that exist in the before times, or is that a since the pandemic?
No, that actually existed before. But what we are seeing, many times people may not have known about some of those services prior to. I think the pandemic has certainly created knowledge sometimes about services. We have people who have not accessed many of these services before. In fact, many times they were donating to some of these organizations, and now they are needing to be recipients of some of these services. So I do think the impact of the pandemic has people that maybe in the past they had enough social supports that they were able to manage, especially if they already did have behavioral health issues. They were able to manage with various social supports that they have already. But in this particular case, that particular program, the friendly calling, the assistance with reminders for medication, that was a program that was already there. But certainly many people may be aware of it now, or if not, certainly call 211 and you can find out about all sorts of resources.
That's great, helpful stuff. Thank you, Lisa.
Mhm.
Next question. In many regions, our questioner asks, there have not been enough mental health professionals to cover the need. What is Syracuse and the rest of the mental health community here in our area doing to address this? Anybody want to take that? Ron or Lisa, maybe?
Well, I would just add the issue of the need for more mental health providers. I certainly believe that certainly was an issue before, and it is an issue now. I will say there certainly has been an increase in the past couple of years of the utilization of peers and how they can help support the system, the behavioral health system in the community. And they have provided, much needed support to persons in the community. But that certainly is not an answer to everything that needs to take place. But that certainly is an ongoing issue about how do we provide adequate, accessible, and culturally appropriate and knowledgeable and trained behavioral health providers in the community.
Gotcha.
The only thing I would add is that the telehealth support that's been received by us from the insurers and the government is really helpful, because at our organization, bringing new providers on has always been limited by the fact that there's not typically a lot of people moving into Syracuse. But with the telehealth, we're able to, what we're starting to do at my organization is recruit people from outside this geographic location to see our local population. I'm really hoping that after the intensity of this crisis, which hopefully will be pretty soon, that these abilities to use telehealth and phone remain.
I presume that was a trend already in existence for a while now, but probably sort of sped up by current circumstances?
It was actually sped up, and actually it was a lot easier to apply to get the waiver to be able to provide those services. So that was really as a result of the impact of COVID, trying to figure out how can we provide behavioral health supports. And so the waiver request to be able to provide that telehealth, that was really as a result of the pandemic. Some of it was in the works, but it was a lot easier to apply and get that approval from the state. So, and what we are hoping, and it's come before our New York State Behavioral Health Services Advisory Committee, there certainly has been discussion about, what of that can remain. And because in some instances, we do also have to remember, some places or communities, they may not have Wi-Fi, they may not have phones that have the internet. So while it has been helpful in many instances for many people, if you're in a place where you had to travel to go to see a provider face-to-face, but you didn't have travel time, enough to be able to do that at work or at lunchtime. People can sit at their desk with their phone. So that's been very helpful. But we also have to acknowledge there parts in rural areas where they may not have, or persons that may not have Wi-Fi and internet connections, where there are still barriers for them. But right now, there also is the option to actually do the just the audio. So if someone could talk with someone via phone. So that is another option right now as well.
Very good.
Interestingly, Excellus Blue Cross Blue Shield, prior to the pandemic, authorized both phone and telehealth sessions. A lot of insurers had what they called an originating requirement, which is the person receiving the services had to be in a facility like a medical practice or some other facility, which really put the kibosh on the whole deal.
Gotcha.
Yeah.
Paul or Marla, I don't want to, if you have anything to say on this, feel free. Otherwise, all right, next question. Ron, a question for you. The person who posed the question asks why it seems like there's so little concern for and or attention to the mental health issues having to deal with COVID and all that it's brought to light. What would be recommended for someone who is struggling through all that comes with pretending to function as if nothing has changed because their work environment is toxic with denial? That is, very little changes and failure to address issues.
Well, let's see, the question has a lot of parts.
Mm-hmm.
And I think my reading of the question is the person needs more support at work and isn't feeling understood. So what are the ways to advocate for that? And probably my co-panelists could talk well about that. So it's, does the person have social support at work? Are there peers that he or she can talk to? Or is there some pathway to talk to the decision makers to say, hey, I need this and this and this to help me not only function, but to do well. There's another part of that I want to pick up on that I don't think was really the intention, which is, I think there's a lot to be said these days for persisting, for putting one foot in front of the other, for showing up. And I'm grateful, my organization, for the people who are just putting one foot in front of the other and trying to do the best they can every day. So there's a lot to be said for that. And not to discount the questioner's concerns about not getting enough support at work.
Gotcha. Thank you. We have some questions, a set of related questions on accessing resources, what's available. Marla, a question for you. To help families address or deal with the burnout of their loved ones who are frontline workers during the pandemic, what might you suggest?
Well, certainly I would suggest let them get some sleep because I think, unfortunately, our essential workers, many people are putting a lot of hours, whether it's a healthcare provider or somebody working at Targets or the person, making food in the cafeteria at the hospital. People are putting in some darn long hours. So when somebody comes home, I think people need to know that's their sanctuary. That's their time to get some sleep. That's their time to get recharged, to make a favorite meal for your loved one, to let them know you missed them. Families, I don't know how families are doing it with young kids where, somebody's an essential worker and then the other person's home trying to work from home and you're trying to meet the needs of your children. So again, I think to make things as simple as possible for you, it's okay to order pizza. It's okay to have cereal for supper some nights, do what is doable, and just give yourself credit for doing the best you can. And yes, you want to be supportive to your loved one who's an essential worker. And sometimes just the issue of giving a person a hug, but like Lisa brought up, sometimes we're not able to give hugs right now. And some of the essential workers, if they're in a hospital, they're coming home and they're isolating and they feel like they don't want to expose their kids or their, partner. So, I mean, that does make things even more difficult, but writing even a little note, packing it in with a lunch to go to the person to just say, I really love you. I'm so proud of you. We're going to get through this. So encouragement, kindness. I think Lisa had brought up some of the issues that, just the strain. And, when Ron brought this up too, the strain that we've had this year, that not only did we have the pandemic, but then we had the political divisiveness, we've had the racial disparities, the trauma of seeing, people die on camera from, police catastrophes. This has been a year of just in your face hardship. So what can you do in your own little world? You can be kind. You can buy the person behind you in line at the Dunkin' Donut, pay for their coffee, do care packages for the essential workers, drop them off at the firehouse or drop them off at the hospital, but extend kindness to others, and that ripples along and helps save us all from just the negativity that has circulated this year. So our positivity, our kindness can make a difference.
Good. Well, thank you.
So.
Ron, a question for you, I guess in some ways related. For families where all their kids, to include themselves, are working, schooling at home, I guess a question related to families where everybody's working, schooling, everybody's at home, thus experiencing great fatigue and being available 24/7. Any suggestions on how to deal with a situation which I'm sure a lot of families are facing right now?
Well, I'll follow up Marla's brilliant answer by underscoring everything she just said. Yeah, she really focused on flexibility. This isn't the time to fight with your teenager about sleeping too late. This is the time to try to not lose your cool. I actually teach parents and kids that model of the resilience zone, being bumped out high, being bumped out low, and noticing each other's zones, and then trying to do something generous, like Marla was talking about, to help that person. So in the studies that I've seen about the families that do best, it's families that have the trait of flexibility, where they're not rigid, where they can go with the flow, where the expectations, call it parental expectations, are guided not only by the kind of rules and what should be taught, but also about that, hey, this is a hard time. Encourage people to think about, well, if it's in the future, how do I want to look back on this? I want to look back and think that there were times I didn't lose my cool with my kids, that we were able to stay working and functioning together pretty well. So this is the time to enhance coping skills. This is the time to teach kids that when things are going poorly, draw on your coping skills. Social support, reach out to friends, play online games together, do things to entertain yourself, like read, play an instrument. This is a time to be kind to your annoying brother, to help others, to call your grandmother, to go shovel snow for a neighbor. And then to notice what happens to yourself when you do that, to notice what happens inside to your zone when you're doing these things. So, and thank you, Marla, for that lead into that answer.
Mhm. Ron, I'll stay with you just for a moment. A question came in over the Q&A just a few moments ago, and since it's related, are you seeing perhaps different specific mental health issues among children who have been isolated and staying at home during this time, perhaps different in nature or degree than before?
I think kids are what I've seen. So we might, see over, I don't know, 1,500 people a month, and many children and families. And I think they're struggling. Kids want to be with their friends, and also kids need to be run around to discharge that excess energy. I've seen a lot of previously excellent students failing, get failing grades. Kids feel pent up in the best of times, and here it's, we've got enforced isolation often. So yeah, I think this is a really hard time, and it goes back to what we were talking about before about each family drawing on its creativity, trying to enhance its flexibility. I think in a family where a lot of people need resources, they have to have open conversations about sharing of those resources and respecting boundaries.
Great, thank you.
Brian, I would just add to that. Again, when we think about children, and I'm thinking in addition, children that may have special needs or developmental disabilities, you add to that, that they're not able to, as many other children with behavioral health issues, to access supports in the same way. And for them, it's probably even more difficult for options such as telehealth or audio health to maybe really provide that kind of support compared to even more typical children. So I will, if you were a child who was getting occupational therapy and physical therapy, and if mom or dad is an essential worker, they're not there during the day. And, even if you do have an iPad or a computer, that's the if, then how are you able to access or get those services? So I think there have been some real additional challenges related to school-age children when it comes to accessing services and supports. And I would also add any impact, children are part of family systems. And, I would say any stress on that family, on those adults, whether it's loss of job, loss of health insurance, or other health-related or behavioral health issues, if those adults in the home are struggling or being challenged, the potential for that impacting those children and for them to somehow also be experiencing additional stress and anxiety as a result of what those adults are dealing with. And I would also, the same could hold true if those children are dealing with additional anxiety, the family or caregivers who are having to normally, there were other services and supports that family could have that now they aren't able to access. If you're the parent of a child with a behavioral health or some other developmental disability, that can certainly add to that those parents heightened level of anxiety and frustration. So,
Gotcha. Thank you for sharing that. Marla, a question for you. What can religious organizations do? What resources can they bring to bear to address some of the challenges we've been discussing?
Oh, I think churches and synagogues and temples probably are already doing plenty. I know I go to Grace Episcopal Church, and what they've been doing is they've set up a phone tree. So people are assigned to call somebody and keep track of them, send them a card, especially for older people, older than me, more gray hair, who are more isolated and can't get out. So, I think Josie Adkins, who's dropping off, packages of cookies for for Roberta, so people are doing these kindnesses for one another. And again, touching base with folks, just calling to, check in, make sure you're doing okay. How are things going? Gee, isn't the snow beautiful today? So just to chit chat and check in with folks and, let them know that people care about them and that they really aren't alone. They may be alone in their apartment right now, but spiritually they're not alone. That, other people are thinking about them and caring for them. I know Lisa had mentioned about, 211 and that they'll call and do the friendly reminders. So I think there's a lot of resources that people can take advantage of. And certainly, if you don't know what your church or synagogue or temple or mosque is doing, give somebody a call and find out and let them know that you'd like more contact. Don't just sit passively in the chair. If you want to talk to people, you want people calling you, then let people know that. Or maybe you volunteer to be the one to make phone calls or send a card to somebody. I know a lot of churches, and the church I attend included, are doing the online, Zoom services, and it's not the same as being together, but you know what? It's still nice to see people's faces, and it's still nice to share that time with one another. So that's very comforting. So again, if you don't know what your religious organization is doing, make a call and find out and let them know that you want to be connected. A couple other things I had failed to mention
Please.
is the NAMI Syracuse phone line. If you have a family member who has a mental illness and you're looking for support, you can call us at 487-2085. Another phone number that I keep in my phone is the suicide prevention line. That's a 1-800-273-8255, because there are going to be times that you become concerned for someone, either in your family or a friend, or even for yourself. That Ron talked about that issue of, are you stuck? Are you stuck in the low zone? Are those negative thoughts so intrusive on you that you're feeling really like there's no way out but to get out? So if you start having suicidal thoughts, or someone that you know and love is talking about that they just can't do this anymore, you want to reach out for help. So I just wanted to be sure to mention that there are limits for all of us, and there's no shame in saying, I've hit the brick wall. I got nothing left, and I don't know what to do. So please don't feel alone. Don't feel ashamed. We're all in this together, and we want to get through this together. Lisa mentioned suicide rates are up, for children, for veterans, for the elderly. I mean, the rates in every age group have gone up, and we can't afford to lose any more people. We've lost far too many already to COVID. And so please, you're not alone. Reach out.
Well said. I put those numbers both for the Syracuse NAMI office and the Suicide Prevention Lifeline in the chat if anybody needs them.
Thanks.
I see we're getting close to time. We have time perhaps for one more question.
Brian, could I just mention one thing?
Yeah.
This is kind of a subgroup, but I know there had a question had come in earlier about college students. And so many of the services for college students, our office had convened a coalition of the university counseling centers.
And that's the question I was going to pose to you right now. Anyway,
okay.
So good transition.
Okay, I'm sorry. Prior to COVID, that group had been convening, sharing best practices and everything. But many of the university counseling centers, SUNY Upstate is working with many of the colleges, OCC in particular, in providing their services, telehealth services. Lemoyne College and Syracuse University have all had available for their students telehealth services, as well as I think SU also had some case management services. And many of these services are extended to students even during breaks or the summertime when they may be away. So certainly the colleges have also looked for ways in which they could be creative and continue to serve the students that they have that may need additional supports as well.
Great. Well, thank you. Well, in the interest of time, I'll turn it back over to Paul and Rita, whoever's going next, but I'll offer my thanks to everybody in the panel. It's great stuff, very informative, and appreciate your time.
Thanks, Brian. And I'll just add my thanks to the panelists. You've shared some wonderful information and resources, and thank you for your time today. And again, thank you to Focus Group Syracuse for helping to get the word out about this very important topic. And I'll turn things over to Rita.
Okay, third time around. Thank you to our panelists. Your experience and expertise has just been wonderful, and we're so happy you were able to share it with us. And Paul, for moderating, we appreciate your efforts there as well. I hope this has been a great experience for everyone, all of our audience. I know it has been for me. We'll be posting this forum on the Focus website shortly on focussyracuse.org if you know of anybody who may want to watch this. Focus is officially announcing today our free virtual Wisdom Keeper event to be held on Wednesday, January 27th at 5:30 p.m. This year, we are honoring the entire Central New York community for service, resilience, and innovation in the face of COVID. During this event, we will hear from several individuals on their positive reflections of their experiences in this past year. So please watch for more information regarding this event, including on our website, focussyracuse.org. Thanks to everybody. Have a wonderful day and a happy holiday season. Take care.